basically the vulnerable populations, this isn't just about responding to specific groups in refugee camps or conflict areas. It's about dealing with entire countries whose national healthcare systems are weakened. Which will just put further strain on those. So from a business perspective, what you can do is work with the local governments and public local authorities and feed into the locally led responses, which have proven to be the most responsive. And another thing you can do is look at what has happened elsewhere, what's worked, what hasn't worked, learn from, people talk about the next kind of third wave that's going to hit Africa, which is what the question was about. But really it's, wherever it is, you want to look and see, like Hans Peter had said, look and see what had worked in Asia and build upon those best practices. Also yesterday, the UN launched the Global Humanitarian Appeal, which is seeking $2 billion, which is largely going to be money from states to address the most vulnerable countries. And that money will be funneled to help those most in need. But then from a business perspective, you can work with the local businesses or local governments would be my suggestion.
There are a lot of people in the world who weren't necessarily in the best condition or the best circumstances before COVID-19. And this is not going to make their lives easier. And so it's really important, as Margaret mentioned, that we have the humanitarian appeal, that we not lose sight of that, but we somehow try and cover as much as we can and support governments and support health authorities. And this is where, if your networks are strong in countries, please use those. Please, to the level that you are able to influence government in saying this is what we can bring that can support your response and reach the people who need help. Please do so, knowing that many governments are scrambling and some haven't even been engaged yet in the worst part of the outbreak.